Welcome to Health Policy. My name is Dr. LaVon Downey, and I've published a whole lot and done tons of presentations, and I'm very active in a whole lot of things. Really glad you're here. Want to sort of give you an overview of what is health policy. It's something that happens at every single level. It is something that even if you don't think you need to know about as a health administrator, doctor, uh, program manager of a nonprofit that does anything related to health, and 70% of nonprofits do something about health. You sort of have to understand the process to know how you'll be impacted, whether that's financially or your patients are impacted, or administrative things you have to do, or trainings you have to do for your staff, or ways you have to ask for money. So health policy is really important to know because it impacts you at all times. And once you know the system, you can impact the system. So it's also important to learn how you impact the system at each level. One of the best parts about health policy, even though sometimes we don't get the health policy we think we should, is that there are lots of little touch points and little places where you can have an impact. And I think that is the most encouraging part. There's always room for change. Nothing is set in stone, which is good and bad. But it is a very, very activist, interventionist kind of policy. It is never one and done. It is dynamic, and it happens again at the local level, at the state level, at the federal level, and also international. Health policy is made sometimes through our foreign policy, so you have to sort of understand different systems. It's not as complex as you think, but it is a lot of things to juggle all at once and a lot of things to pay attention to. It will make you probably want to become an activist, which is great. As I said, that's one of the things that I actually do with global policy, global health policy. I go and talk to senators and educate them about why they should support certain policy initiatives. I work for the United Nations and do that also. So those are opportunities, and we have clubs like that on the campus. I'm the advisor for that, so you can certainly become involved in that, and I can send out information for that. Just reach out and let me know. So you can sort of see it close up. But you can also see how it's made. Sometimes it's not so good to see how it's made, but I think that no matter what, it's really good to see how it's made, because I think some of you will actually go on to make health policy. And the more you know the system, also the more you know which players you have to include and how you placate them or get them on board. So it's not just you're going to be a passive recipient of health policy, or you're just going to administer health policy, but hopefully some of you after this class will be emboldened to actually make health policy, whether that be testifying, whether that be lobbying for certain policies, pushing for certain referendums, actually going to run for office and having a knowledge about health policy so that you can make better ones. All is great and good, and hopefully you will take away some of those bits from this class, and at a minimum have you be a better administrator and improve patient care. At a maximum, maybe be part of the solution and or addressing the problems no matter where they are with health, and improving the entire, not just your local health, but policy that improves everyone's health care no matter where they live.